We're working with a company called Morningside Analytics, and their specialty is network science and audience clustering. So in this example, and this is actually a real mock-up of all of the different Twitter accounts around big pharma. So if you were trying to tell a story about big pharmaceutical companies having a really strong influence on healthcare policy, how would you tell a story like that? Now, reaching out to certain experts, if experts were to tell you that really who you need to reach are pharmacists, because they're really the gatekeepers between the medicine and the public. So you can see all the categories on the right-hand side there. I'm going to turn them all off and then turn on pharmacists at the very bottom. I'm not sure how clearly you guys can see this, but there's a cluster of blue that showed up on the top left. And so you can see there, these are the different pharmacists who are engaged in the conversation around big pharma. Now, if you were trying to talk about a particular subtopic of healthcare, like various conditions that patients go through, in order to reach pharmacists as an audience group, let's say you turned on HIV/AIDS in terms of those audience groups. They're pretty far away, you can see, from pharmacists. And this map is created based on who's following who. And so there's not much of an overlap between the pharmacists who are thinking about big pharma and HIV/AIDS groups who are thinking about big pharma. Let's try cancer. It's getting a little closer. You can see it's a bit more central. You can try cardio. We're getting a little closer now. We're moving up to the top left with this particular audience group. But look what happens when I toggle on diabetes. It's a really rich cluster that's right beside pharmacists. So right away, I can even turn on diabetes organizations. Right away, you can see there's a much bigger overlap. So if someone was trying to think about a story around big pharma that would reach pharmacists, it'd probably be much better to pick a topic like diabetes instead of HIV and cancer.